Hello, I'm Dr. David Haase, and we're going to talk about NAD today. I love this topic because I have been rather obsessed with the mitochondria for 20 years. And I've taught thousands of physicians about the mitochondria, and so this is going to be a lot of fun for us to dig into. I'm medical director here at the MaxWell Clinic, and we've been utilizing NAD in our therapies for almost 15 years. This is nothing new. We've been using it medically for specific patients, and we really understand this molecule. So let's get into some details, okay? NAD is a molecule, stands for nicotine adenosine dinucleotide. And as a molecule, it serves a super important central role in the maintenance and the production and the distribution of energy in the cell. So NAD has a partner called NADH. When these two forms of the molecule bounce back and forth, they're basically transferring protons back and forth. And this movement of protons, which are a positively charged molecule, enable the distribution of energy inside the cell. NAD is central to this whole process of taking food, whether that be fats, carbohydrates, or proteins, and breaking down the energy and the chemical bonds of those foods and converting it finally into a molecule called ATP. ATP is your energy currency of the body. And so if you want to go from food to molecular energy, NAD is critical in between. Well, the benefits of IV NAD really boils down to energy and information. So first of all, NAD as a molecule is important in the transition of energy in the body. It converts between NAD and NADH back and forth, kind of like a water wheel that helps collect energy from one place and transfer it somewhere else. So any disease issue that has a central problem with energy could be improved with normal levels of NAD in the body. It's been used greatly for strategies for reducing the accelerated aging. Restoring depleted NAD levels in laboratory animals can slow and even reverse aspects of aging and can delay progression of age-related diseases. IV NAD is incredibly useful, and we've used it for many years in the treatment of addiction and recovery. I'll want to go into that in depth in some other videos, but addiction management is one of these very difficult problems to address, and we've missed out on taking a metabolic approach to the problem of addiction. NAD is part of that potential solution for everything from opioids, alcohol, tobacco, prescription drugs. NAD, when it's low, is certainly a risk factor for heart health, and we see challenges with blood pressure. So supporting NAD can improve long-term blood pressure, we believe. And NAD helps with muscle recovery. When high-performance athletes need that extra edge, or when an individual with profound chronic fatigue needs that extra edge just so they can get through the day, healthy levels of NAD really support that. When it comes to energy, there's no organ that consumes more energy than the brain. So focus and concentration are supported by having adequate levels of NAD in the cellular architecture. Also, if you have enough energy, the body has the ability to protect itself from things like free radical hits or oxidative damage. NAD may also prevent cell death because the mechanism of apoptosis and mitosis have a lot of control regulation with regard to the levels of NAD in the body. And it's been noted that NAD levels are deeply connected to sleep and circadian rhythms. Balancing this cofactor may really help restore normal sleep cycles and hunger patterns. Pretty remarkable little molecule. A lot of times we're asked, why not just supplement with oral NAD? And one of the challenges there is that NAD gets broken down in the GI tract and is not really absorbed and taken, from the stomach or from the GI tract into the bloodstream to cross the multiple cell membrane layers to get into the mitochondria. It just doesn't make it. And that's therefore a lot of carriers have been proposed, like nicotinic riboside is taking a precursor of NAD and giving it another carrier molecule. It hasn't turned out to be very effective in raising the body's levels of NAD when taken orally. If we want to get past the barrier that is the GI tract or the skin, a needle is a great way to do it. Well, NAD goes down as we age, and really we can take a look at kind of the level of vitality for an individual. And when we measure NAD levels, it's quite profound how closely these measurements of cellular health go along with the actual expression of body-wide health. And there's no question that the decrease of the levels of NAD in a person is a hallmark of the aging process. So this is where the big curiosity has come. It's like, well, if we can replace and restore the level of NAD to the level of a young individual, do we essentially turn back the clock? And there's so many behaviors and other inputs that help regulate NAD in the body. And most all of those things that are healthy for a person also will raise the level of NAD that is inside the cell. But the bottom line is NAD levels go down as you age. And the need for restoring those levels goes up the older we get. When you receive your first IV NAD, it's an experience because NAD is a molecule of exhaustion. So I've mentioned that NAD has a partner molecule, NADH, which is the energized form of this molecule. And when you have an infusion of NAD, you're going to raise the level of the molecule that has not been charged up yet. The body recognizes that and understands that I am in a state, it believes it's in a state of energy depletion, but it's not really. We're actually tricking the body into thinking that it is exhausted. So the body comes back and turns on the cellular machinery to create more energy. It's a really cool trick because what also raises the level of NAD is fasting, exercise, all these things that temporarily deplete our energy stores cause that to happen. So how do you feel if you've exercised really heavily or you've been fasting for a long time? Well, it's the same way you feel if you get an IV of NAD. It can make you feel kind of tired. If you run a very long way, you can feel a little nauseated, headachy. It's like, oh, I want this to be done. And all this has a lot to do with how fast the IV is run in. That's why it's really important to have this therapy done in a place that has a great deal of experience and understands the why behind why you're getting this done. So when you get an IV of NAD, it's quite remarkable. The side effects or these effects that go on can get turned off just as fast as you shutting off the flow of the IV. Some of these symptoms that are very unique for each individual go along with their pattern of injury or inefficiency in the body. I've noticed that people that have some reflux issues will note that they have heat in their gastroesophageal junction. Individuals with maybe chronic mono will notice that their lymph nodes and the area in the throat will start to get hot. Other individuals with musculoskeletal injuries will realize that they have an intensity of experience in those joints. And all of that's very temporary, and as soon as the IV drip is turned off or is completed, those symptoms go away. So it's very important to find a drip rate that works for you. We do monitoring to assure your safety in this process, and we're very well accustomed to helping guide people through this process. The people who should consider NAD therapy are those individuals that are experiencing symptoms of chronic fatigue or low energy. And this almost always goes along with brain problems, because when we have low brain energy, we have all kinds of symptoms that come from that. It could come up as an erratic mood or low mood, the inability to concentrate, the inability to hold on to memories as well as one did before. We often don't think that inability to recover from exercise is a brain symptom, but it really is in many ways. So NAD can be very helpful for improving energy recovery post-exercise. IV NAD can be very helpful for those people who just want to optimize their cognitive function and mental clarity. We take care of a lot of world changers here at MaxWell Clinic, and NAD is really important in their care because they know that an extra 1% of improved performance may mean the difference between them achieving their very lofty goals or not being able to achieve those goals. Individuals that are dealing with chronic stress or burnout, wow, those individuals can really be helped with IV NAD because it helps to not just restore the levels of NAD in the body, but it helps turn on the cellular machinery that causes the body's ability to produce energy in the long term. So we look at this as an interventional strategy. IV NAD can be looked at as a nutritional strategy or as a molecular intervention, and they both have appropriate places in a person's course of health and disease. Another person that can benefit from IV NAD are those people who just really want to have healthy aging. Want to make certain that the life experience that they are going to have in the future is the best life experience possible. Prevention really is far more potent than cure. Or I mentioned athletes that want to enhance or optimize their athletic performance are helped with IV NAD. And the two areas that are really near and dear to my heart are those individuals with neurodegenerative conditions, such as Alzheimer's, Parkinson's disease. They often have a component of their disease that has to do with mitochondrial dysfunction, and IV NAD can be really helpful in that area. And finally, where IV NAD really started was in the treatment of addictive problems, because inside addiction, you can change the behavior of dopamine secreting cells so that the drive towards seeking out the substance that one is addicted to is diminished. IV NAD can be absolutely transformative in a comprehensive addiction recovery program. So there are some people who really should avoid IV NAD therapy. And I think it's important to recognize, first of all, the decision to do these types of therapy should be done in conjunction with a clinician who knows what they're talking about. I don't think this should be ordered like going through McDonald's. But a couple of populations you really want to be looking for are like pregnant or breastfeeding women. We just don't have a lot of research in these populations. Individuals with severe kidney or liver dysfunction, we would take extra special care, and they would need additional monitoring and possibly not be qualified for this therapy at all. There are some individuals with rare genetic conditions that affect NAD metabolism and mitochondrial function, so the individuals who are severely ill should absolutely be seeking out a qualified professional to help guide them in this process. Anybody that has uncontrolled high blood pressure or severe cardiovascular disease should avoid IV NAD, especially because one of the symptoms of having an infusion can be chest discomfort, which may or may not be associated with coronary artery vasospasm. And so you don't want to miss an actual cardiac event, when what is really happening is the IV NAD is just causing a symptom without actual arterial closing. And then also individuals with a history of severe allergic reactions to IV treatments. Make certain that you are always recognizing that you're taking care of yourself as a whole person and not just prioritizing any one therapy that it's going to fix everything about you. Recognizing that there's always a potential downside to every therapy is honest medical care. And you should be in conversation with your clinician about how this is best for you. NAD levels in the body, inside the cells, naturally, or I should say usually, goes down as you accumulate birthdays, right? So the older you got, the less NAD is going to be inside your mitochondria, and the less NAD likely is, or less NAD in your cells. This is a big problem because NAD is not just a molecule of energy, but it's a molecule of information. And it is very important to help support sirtuin activity. Now, sirtuins are some of the genes that are most closely associated with great longevity and stress resilience. The decline of NAD inside the cells has to do with the aging process, and therefore we see a susceptibility to multiple diseases of aging. So by thinking about NAD as a primary strategy for improving cellular health and cellular energy production, we have the potential to treat many different conditions simultaneously, very deep near the root. NAD enhances mitochondrial function, and the mitochondria are the place where your food becomes ATP, which is kind of like gasoline for an internal combustion engine. It is the fuel that all of your molecular machinery works on. Without NAD in the middle, you can't do that conversion. And because NAD levels go down with aging, then you have a decreased ability to do the work of whatever that cell needs to do. NAD also helps maintain your telomere length. So telomeres are end caps that go on your chromosomes. And we want those long because that allows the cell to reproduce many times and repair effectively. The more those telomeres shrink, the shorter the lifespan of that cell in its ability to replicate and repair. So supporting telomere length is an important part of keeping your machinery of repair functioning well. And finally, NAD supports your cellular metabolism and your overall health. If you don't have energy, you can't do the work of life. And NAD is a very important intermediate molecule in this production of energy. NAD is an incredibly important molecule when we start thinking about cognitive function. Because this brain, that little chunk of flesh up there in your skull, only weighs about 2.5 pounds. But it consumes almost 23% of your daily energy. That's amazing. And so if you think about it on a per centimeter basis, right, on a per mass basis, that brain is consuming oxygen and making energy and running hot. So any decrease in the ability of this high performance tissue in being able to do the work it needs to do, any small change in that and you'll experience it as brain function problems. So you need adequate NAD to make new brain cells in the areas of the brain that can repair. And you also need NAD in order to support neuroplasticity, which is the rewiring that goes on in the brain as you learn. It's important for helping with memory and every learning process. Neuroplasticity is really the centerpiece of regenerative brain health. NAD really helps to reduce oxidative stress in the brain, because when the engine can run clean, there's less soot and smoke made. And NAD enables, that engine to be doing its best work in converting food into ATP. NAD improves the mitochondrial function in the brain. It helps enhance energy production. And we've noticed it really being very helpful in decreasing brain fog, improving focus, decreasing fatigue, shifting mood, and even improving attention. NAD can support the repair of DNA damage in neurons that is going to accelerate cognitive decline. NAD is an incredibly important molecule in brain health, and this is one of the reasons why we think of it often for individuals who want better brain function. IV NAD has been used for the supporting peak athletic performance for a long time. And because your athletic performance is tremendously dependent upon your energy. You have to have the fuel in order to propel the machine in any way that you want to propel it. And if you're low in NAD, it turns out that you have slowed recovery in not just the ability to bounce back and perform in your athletic endeavors, but also in the ability to recover via repair of the damage that came from your athletic performance. We've noticed that NAD is associated with reducing inflammation that is associated with intense exercise. And a lot of that inflammation comes from high levels of oxidative stress for individuals that are going through peak performance type activities. We see IV NAD improving endurance. We'll very frequently have our patients drop in before they're going on their next marathon, triathlon, or even wanting to go out for the weekend and make certain that they're going to be able to recover well from whatever they're doing for peak performance on the weekend. NAD can really support efficient glucose metabolism, so you can utilize the sugar that's coming through your body, and it can potentially enhance your stamina. You need adequate NAD in maintaining your muscle mass and strength. This is super important as we age, and we also know that NAD levels go down quite substantially as we gather birthdays. So pay attention to your NAD. It's really important for your peak athletic performance. So when we think about NAD and its interface with mood disorders such as anxiety or depression or just the experience of blah life, I think it's important to step back and think about molecular function. Like, why do you have these symptoms in the first place? And the symptoms of anxiety and depression are often alerting you to the problem that something's wrong. Oftentimes there's associated neuroinflammation. Sometimes there is an injury process going on with brain cells. And these symptoms are letting you know that something isn't as it should be, and you should change your behavior in some way. So research is ongoing in this sphere when we think about the interface of NAD and how it may regulate mood. We know that you need adequate cellular energy to make sufficient neurotransmitters like serotonin and dopamine. We know that NAD is very important in supporting low oxidative stress in the body. When there's high oxidative stress in the brain, we know that that's associated with higher levels of anxiety and depression. And we've really noticed that individuals after having IV NAD really can have some really profound improved emotional resilience after this therapy. Just feeling like, wow, I have more ability to deal with what's going on inside my mind and outside in my world. Even if you are under other therapies for anxiety and depression, supporting cellular energy may help the effectiveness of those other treatments. these should be made on an individual basis in consultation with your informed clinician. A typical IV NAD session can range anywhere from 1 to 4 hours. I would even say 1 to 8 hours. Really depends tremendously on the dosage. It matters the person. It matters what clinical outcome are we shooting for. Are we working to increase the body's available NAD? Are we trying to change the genetic expression pattern? All of this will cause modifications in the protocol for your particular needs. The infusion rate is carefully controlled because we want to enhance our optimal absorption. We want to get the most opportunity for optimal results as possible. Some patients require longer sessions initially, and as those NAD levels build up in the body, the time that it takes to complete an infusion can go down and down and down. But we customize the duration based obviously on individual needs and responses. Always make certain that you are being treated as an individual. There's no instruction book for you. So don't take somebody else's instruction book and think that that is you. Demand individualized care. The question is often how many IV NAD sessions might someone need. That's also dependent upon the individual challenge that you're going through. We've done some really profound transcriptomic studies where we actually are marking and measuring genetic changes as it regards the IV NAD. And we've recognized that there's a different dosing level for different individuals. We customize that here. But an initial typical protocol can involve anywhere from 4 to 10 sessions over a couple of weeks. Maintenance sessions could be recommended monthly or quarterly, and we assess each patient's response and adjust the protocol accordingly. There's also additional supportive therapies that are helpful. And we, of course, want to engage the lifestyle factors that are going to help you make NAD long-term on your own. Well, what you can expect to experience during an IV NAD session has a lot to do with how it's given to you. So in our center, where we have a great experience in this process, some patients will start to notice a mild flushing sensation as the NAD is going on. Oftentimes that progresses on into the feeling of more tiredness or some fatigue while you're sitting in the chair. There can be some achiness in areas of the body that have had prior injury. And all of those transient effects go away as soon as the IV is stopped or interrupted, even for a short moment in time. But the after effects are pretty remarkable. Some individuals experience really improved sleep quality, improved mental clarity, improved energy, and just joie de vivre. And this idea that you have better stress resiliency and enhanced mood has certainly been something we have observed. It's also noticeable to see that physical performance may be really noticeably improved during or after IV NAD series. We've had several of our high-performance athletes report back to us their clearly measured improvements in their own personal performance with their customized approach. And we really think that these results can be cumulative, meaning they build upon each other. So the benefits that you get from the first IV are less than that you get from the 8th IV. And certainly as we approach each patient comprehensively, searching for what are all those things that may diminish your NAD levels in your body, and removing those and supporting all the other factors that can build up your NAD in your body and supporting those make a big difference as well. This is really important. And unfortunately, I've heard of a lot of instances where other centers are injecting NAD into a bag with other molecules, and that's not a good idea. Please don't get your care there. But NAD therapy can complement a lot of other health interventions. It can be combined with specific nutritional supplements for synergistic effects. And NAD, by improving cellular energy, can enhance the effectiveness of certain medications. We've certainly seen that with blood pressure being better controlled after individuals have restored their normal levels of NAD. We always use it alongside of diet and lifestyle interventions, and really look at it as part of a comprehensive treatment plan. So it's important to consult with your healthcare provider about combining therapies, both when you're in the IV suite and the kind of therapies that your NAD would be combined with in the rest of your life. Many patients can return to work right after their IV NAD session. Matter of fact, almost everybody. However, we do recommend scheduling sessions when you can rest afterward, especially your first couple, so you understand how your body is responding to this new information that's coming in. A few individuals can experience some fatigue or mild discomfort post-treatment. However, mental clarity usually improves, which can be pretty great for completing cognitive tasks. We do encourage physical exertion, slightly limited on your treatment days, unless, of course, you're going to be doing this IV NAD specifically to enhance your physical performance. Everything is contextual according to what we're shooting for. Oftentimes, combining exercise and IV NAD can be optimal as well, but it depends upon you. So we need to listen to your body, be really clear about your goals, understand your metabolic health as a whole, and then use that information all together to help give you the best possible treatment strategy to optimize results that you're looking for. With this incredible rise of NAD utilization in the world, it's been concerning to see where some of the sources are coming from. Because when you're injecting something into your body, you might make real sure that that is pure and that it is potent. So we source pharmaceutical grade NAD only from reputable and validated suppliers. Our staff is thoroughly trained in IV administration and patient monitoring. We conduct comprehensive health assessments before initiating treatment. We use sterile technique, medical grade equipment, and we monitor patients very closely during and after each session. We, of course, do the detailed record keeping, and we're constantly reviewing our process to make certain that it has been optimized as much as it can for both safety and efficacy. So remember, while NAD therapy really shows great promise, and we have been gathering some of the most remarkable genetic expression data utilizing NAD therapy, individual responses vary. At MaxWell Clinic, we're committed to personalized care and doing our very best to optimize your health journey with cutting-edge treatments like NAD. If you'd like to learn more, please give us a call at MaxWell Clinic. We'd be more than happy to talk to you and partner with you in your quest to maximize your well-being.